UK hospitals are at breaking point. The number of patients rising despite a national lockdown. The Prime Minister himself has called the number of deaths from coronavirus appalling. But could the UK's crisis have been avoided? And what should happen next? This is Roundtable. Hello there, welcome to the programme. I'm Shuli Ghosh. The UK has suffered more than most European countries during the COVID-19 pandemic. Was it inevitable, or should the government take the blame? The UK recently reached the highest death rate per capita globally. Cases remain high despite a national lockdown, and hospitals are struggling to cope with the influx of patients. On average, more than 1,000 people are dying each day. The UK government has been accused of failing to act swiftly enough during the early stages of the pandemic last March. To some critics, the $30 billion track and trace system has been an expensive waste of time. It was only during early to mid-January 2021 that the UK closed all travel corridors and required proof of a negative COVID test to enter the country. But since December 2020, the UK has led the world in an ambitious plan to vaccinate its population. The government aims to have vaccinated more than 14 million people by mid-February, including the most vulnerable and elderly members of society, with the rest of the adult population to follow by September. So should the government take the blame for the UK's troubles? And how can it win the fight against COVID-19? Let's introduce today's guests. Joining us via Skype from Bristol here in the UK is Dr. Gabriel Scally, President of Epidemiology and Public Health at the Royal Society of Medicine. From Oxford, we have Sian Griffiths, Emeritus Professor at the Chinese University of Hong Kong, who co-chaired the Hong Kong government's SARS inquiry. And in Leicester, Dr. Julian Tang, Consultant Virologist at the Leicester Royal Infirmary. Good to have all of you with us. Dr. Scally, let me start with you because you've been very scathing about the government response. You've called it a phenomenal failure of policy and practice. Do you believe that government failures have led to this astonishing death toll, which is approaching 100,000?
It is a phenomenal death toll, particularly for a country that really prided itself traditionally on having very good public health and very good public health and health service systems. And I do think that some of the changes that have happened in the country in the last 10 years left it ill prepared for this pandemic. And I think the decision making has been extraordinarily poor. And the failure to follow good international practice, the failure to learn from other countries that have handled the pandemic so much better than the UK has, all of that has resulted in the unenviable position in which the UK finds itself now. It really is in a shocking state at the moment.
But the UK is not alone, though, isn't it? I mean, the pandemic has been a massive learning curve for everyone in the world, and we've seen other countries really badly hit. I mean, Belgium, Slovenia, Italy, they all have extremely high death rates.
Oh, indeed, but there are countries like Finland or Norway, and looking further afield, Taiwan, Australia, New Zealand, South Korea, even China, who've all handled it very well. And I must say, as a public health doctor in the UK for the last 40 years, that it's an extraordinary disappointment how badly the UK has handled it. We are on the wrong end of the league table. We should be doing much, much better than we have done.
Professor Griffiths, do you agree with that? And do you think that if we look back to the early days of the pandemic, the UK should have been taking measures much more quickly?
I do agree with Gabriel Scally. I think much of my experience comes from having chaired the Hong Kong government SARS inquiry in 2003. And from that outbreak, which is also SARS is a coronavirus, from that outbreak, we drew out quite a few lessons. And if you look at how countries who also had SARS as Gabriel says, Taiwan, South Korea, Hong Kong, and China, you look at how they responded right in the early days to the fact that this was potentially another epidemic We didn't realize it would be a pandemic then because SARS wasn't a pandemic as such. It was an epidemic because it was a smaller outbreak. But many of the earlier signs were very similar. And you look at how much more quickly countries acted, for example, on travel control, for example, in terms of mask wearing. Many examples of things that were done much more quickly than we had moved in the UK.
Do you agree with that, Dr. Tam? Because when you look at countries like China and New Zealand, as Sian was saying, there were much tougher restrictions implemented at a much earlier stage. Some of these countries closed their borders immediately, for example, whereas the UK really dragged its heels over that.
Yes, I agree with Sian and Gabriel. In fact, I was working in Hong Kong when Sian was there just after SARS. So I'm curious to see what Joe Sung or Gabriel Leung would have said about this situation. But the action of the UK was to downplay the initial reports from China. I remember one of my colleagues from Oxford saying that it's not going to be a serious problem on Radio 4 Today's programme back in January, and we should focus on other things like HIV, TB and malaria. I think that was the major issue. They didn't take it seriously enough, they didn't act quickly enough, and by the time they acted, the virus had already seeded itself well into the population here, along with Italy, Spain and other European countries.
But were scientists taking it seriously at that stage? It wasn't just a government failure, was it? I mean, no one foresaw that it would get to these stages this quickly.
Well, I think a mood of watchful wakefulness may have served the UK better than this immediate response to downplay it all. And I think both Gabriel and Sian are right in that the experience from the other countries, particularly post-SARS, really primed them and geared them to respond very quickly with a more universal approach to the problem, rather than second-guessing themselves, which basically is what the UK government's been doing all this time, second-guessing whether this is going to work, that's going to work, and delaying too long before they actually implemented those measures, which could have saved an extra 10 to 20,000 lives, as suggested by the Imperial College modelling paper that came out a few weeks ago.
I wonder what all of you think about the kind of policies we've seen put in place since then. I mean, they've been ramped up considerably now. But for example, we had this piecemeal tier system, which meant that businesses and pubs and restaurants were closed in some parts of the country, but not in others. Gabriel, what do you think about that? Because it seems a rather bitty approach. Was that ever a valid policy?
I don't think it was, or at least if it was seriously flawed in the way of going about it. There's no doubt about it that there were differential rates of the virus in different parts of the UK. And the government, unfortunately, is a very London-centric, Westminster-centric or Downing Street-centric government. And they haven't devolved authority to the other parts of England. In fact, they abolished the regional structures within England. And they certainly didn't devolve authority, resources, and support to the local authorities and to their local directors of public health. And indeed, I think that's one of the real failures. The poverty of senior public health leadership has really been very, very shocking. And I think the implementation of the tiered system was a London-centric approach. And even when they had the tiers in place, we know that virus numbers, cases, were actually increasing in some of the places which had Tier 4, which was the highest at that time, and the government was very slow to act. People on the ground knew, but they didn't have the resources or the influence or the power to change things, and that's very disappointing.
What do we think about the messaging that the government has been giving out? There was all that ridiculous confusion over Christmas about whether there should be this 5-day free-for-all, which was, very quickly and quite rightly, many believe, rescinded. But one of the accusations has been that the government has not been clear about what its message is. Stay at home, don't stay at home, go and exercise, but don't drive anywhere to go and exercise. Sian, do we feel that the government has been following the science, as it says it has been, or has there been a little bit of let's just make it up because we want to keep our businesses going as much as possible?
There's definitely been that. I think the messaging is very confused, and we haven't stuck to very clear messaging, for example, about masks. And I still remain unclear what the messaging is about masks, because there's so much ambivalence in terms of the way the government treat them and the way that people aren't wearing them. If you look at other countries, leaders are wearing masks all the time when they should be. And so that's just one example. I think another example is the whole thing around, I do go back to travel, because I do think it's a topical issue at the moment, and I do think it's an important one. You know, the quarantine, it's where I think the government was very remains confused. It is about, you know, it's about travel. What is the travel advice, you know, and who can come into the country, and if they come into the country, how do we ensure that the quarantine works effectively? Because I don't think that just telling people to self-quarantine for 14 days is adequate. If you look at countries such as New Zealand, Australia, you know, Taiwan, so much clearer about what you can and can't do in terms of travel. In fact, it's basically, we don't let anybody in, and if you come in, you have to be in quarantine for 2 weeks, and we will make sure you're in quarantine for 2 weeks. So there's been mismessaging in a way. We've been sort of 1 minute it's been this, 1 minute it's been another, and that makes people very confused.
Yeah, travel is a massive source of debate at the moment, and you can see the government coming under pressure from the airline industry, because obviously this is something that impacts on airlines immediately, but of course you need to have the health considerations. So we're currently talking about quarantine hotels here in the UK. Julian, in terms of travel, we've seen different approaches with different countries, haven't we? Some people have closed their borders immediately. Other countries have tried to keep some kind of international travel going. I'm not actually entirely sure what the advice is with travel. I believe I can travel for work, but am I still quarantining at the end of it? What is the safest thing to do? Surely the safest thing to do is to close our borders.
Yeah, so my impression, I think I'm with Gabriel on this, is the government's been too reticent about the advice it's given. It needs to be more convinced that what it's doing is correct and stick to it, regardless of the lobbying by, you know, different groups. Because the problem with this virus is that if you don't control the virus, it impacts on everything: the economy, education, travel. Every sector is affected. You need to control the virus first, and then let the economy recover, let schools recover. Because if you don't, with all this different mixed messaging, the virus will still persist, and you'll still get these surges, because, you know, 80% of the population is still susceptible. So I think not just with travel, with the education, with the economy, hospitality industry, all this, these other factors, you need to be firm. So we're going to control the virus first. We're going to support those other industries until the virus is gone, just like New Zealand did and like Taiwan did. And Taiwan did it even without a national lockdown.
There's more concern over the new coronavirus variants, which it emerged this week, could be linked to slightly higher mortality rates. So Patrick Vallance, the UK's chief scientific officer, had this to say about the South African and Brazilian variants.
We know less about how much more transmissible they are. We are more concerned that they have certain features, which means they might be less susceptible to vaccines, but they are definitely of more concern than the one in the UK at the moment, and we need to keep looking at it and studying this very carefully, which is what's going on in laboratories across the world at the moment.
So Dr. Scally, if I can come to you, if there is concern about these variants coming in from other countries, then surely the only way to stop them coming in is to close the borders.
I think that's entirely correct. Closing the borders, it's not like it's a new way of handling things. For centuries, quarantine has been used to stop highly infectious disease coming into countries. And it is amazing that Ireland and Britain have been about the only islands in the world that haven't put serious controls on their borders. And to do it now would be absolutely the right thing to do. It's a pity they didn't do it earlier, but now there is a chance to try and stop these variants coming. And
why do you think the government's so reluctant to take a measure that drastic?
I don't know why. I don't quite understand their whole tactics, because It's very clear from across the world that countries that have really suppressed the virus, got it down to zero and kept it there, have done extremely well economically. The UK, on the other hand, has been into this very bumpy series of lockdowns and restrictions, and it's played havoc with the communities, havoc with business. It has really disrupted children's life experience at schools, with schools closed, and it's been a really dreadful situation economically and socially that we could have avoided if we had put proper public health controls on our ports and airports. It's not that difficult to do.
Let's talk about the impact of the vaccine rollout. This is one area where the UK has been extremely quick off the mark. Sian, what do you make of the way the government has rolled out this vaccine and the way that it's prioritising who gets it?
I do think this is more of a success story to have actually purchased the vaccine from, I think it's 7 different sources. We've already got the Pfizer-BioNTech, and we've got the Oxford-AstraZeneca being rolled out, and Moderna has been through the MRHA process, and there are other vaccines coming on stream. So our supply of vaccine is becoming more adequate. It was quite limited to start with, but that was for fairly reasonable logistic reasons. And vaccine acceptability in our population in the UK is much higher than in other countries. I think the figure today is that 80% of people said they would come forward when invited, which is actually much better than in countries such as France and even Singapore. So it's not just a sort of a European issue. And I think that, so I do think that the way that, because we have a national health system, we are able to mobilize our general practice, which gives a population coverage, and it means we can reach out to the vulnerable groups. I think that the decision to base prioritization on saving as many lives as possible, so vaccinating in care homes, vaccinating in hospitals, vaccinating care staff, and vaccinating older people who have a much higher risk of mortality. All of those are reasonable decisions, but I do think we need to move forward and say which other groups will be prioritized once we get to them. You know, it's only going to be a couple of weeks until all priority groups should have been vaccinated. We've had large numbers of people vaccinated over the weekend because we've now got the large centres opening. So I think that actually this is a success story in terms of reaching out, and it's because we have a strong national health system, it's because we have good, strong general practice, and we can integrate the response, and we can identify vulnerable people in our communities, and we need to continue to do that.
Yeah, a lot of praise for the fact that we got the vaccine quickly, that a vaccine programme was started quickly. However, government policy is again under scrutiny for extending the gap between injection number 1 and injection number 2. It's now a 12-week gap. It was 21 days before. And the British Medical Association suggesting this could be dangerous. Julian Tang, what are your thoughts on that?
Yes, as a virologist, I see a lot of people who come for their hepatitis B jab and then they don't turn up for the second one, but sometimes they come back for the third one, and then they've got antibodies even before they got that jab. The extension between the first and second jabs, I'm not that worried about. The duration of that extension, well, in fact, if you look at the Pfizer-BioNTech, Moderna, and Oxford-AstraZeneca papers, in fact, they got first dose efficacy data in those papers, which go out to 110 days. So, in fact, they are within that data umbrella of that first jab only. And I've given a talk on this, fairly recently, and have slides on this data. The concern is really whether that lack of total protection may allow vaccine escape variants to develop. Now, we have seen this with some less than 100% take up and efficacy of other vaccines. For example, in Hong Kong and China, we have seen vaccine escape mutants arise in that endemic population who don't get fully immunized against hepatitis B. This may happen with the coronavirus as well.
Well, that sounds worrying.
Vaccine escape mutants, then you can probably develop the vaccine to change in the appropriate way.
So is that a concern, that with the longer gap we could have or encourage viruses, coronavirus, which is resistant to that vaccine? Is that what you're saying?
To some extent, that's possible, but I think this is be a very low number. Even the vaccine escape mutants we see for hepatitis B, which is a much better vaccine, very low numbers. And I suspect that if you vaccinate more people and reduce that transmission rate, the virus has got nowhere to go.
Can I just quickly ask our other guests, what is your view on this extending the gap between vaccines? Because the argument by the government is, of course, that then more people will receive that all-important first dosage. Gabriel, what do you think?
Well, I bow to the expertise of the virologists here and the vaccinologists. I think it's probably a reasonable thing to do when we're in the midst of this crisis of cases and there are so many vulnerable people who haven't had a first dose. It seems to me to be right to try and give, even if it's only partial immunity, to give that partial immunity to the people at highest risk. So I support it.
Right, and Sian, I saw you nodding there. You support that as well, do you?
I agree. I would, as with Gabriel, I bow to the virologists and also to all the experts who've looked at this data. I mean, the JCVI, the Joint Committee on Vaccination and Immunisation, is a very thorough body, and they were in favour of this, and they were advised by David Salisbury, who was basically the UK head of vaccines for many years, and he says that it was one of his recommendations, along with Tony Blair right at the beginning. They said if you can get more people covered with some immunity, it has a better impact. So at the population level, you have more people covered, more people with some immunity. It will help reduce the demand on the NHS. It will help keep people healthier or less ill.
Right.
And I accept that.
And that all hopefully takes us towards this mirage that we're all heading towards, of finally coming out of lockdown and having restrictions lifted. Matt Hancock, the Health Secretary, made quite a gloomy prognosis this week about that. When restrictions might be lifted, he said, we are a long, long, long way from being low enough because the case rate was incredibly high. Gabriel, not just a long way, not just a long, long way, but a long, long, long way from lifting restrictions.
Well, I think we're some distance off indeed, but it's far better to couch it like that. I get very worried anytime Boris Johnson or any of the ministers start giving dates and quoting possible dates, because the danger is it gets people's expectations up and gives them false optimism. And what we need and have needed from the beginning was a realistic approach to this. And so I'm in favour of the realism that it's going to be very rough and rocky, and it will depend not just on border controls to keep out the variants, but we still really don't have good contact tracing and testing of close contacts. Contact tracing is vital, and it hasn't been done well. And there are simple things like that the government could do to bring that distant day. I hope it's not a mirage, but merely a distant view. Bring it a bit closer. There are things the government could do that they're not doing yet.
What would you like to see them do?
Oh, fix the contact tracing would be one. I'd like them to be very clear in their message about masks, as Professor Griffiths was saying. And I would also like them to be very strong about 2-metre distancing. They dropped 2-metre distancing last summer, and they've never really come back to it. And they need to emphasise these issues.
Julian, what do you think it will take to get us out of this pandemic?
Yeah, so we've written several commentaries on ventilation, airborne transmission, and I think the resistance to acknowledge airborne transmission is partly why we're in this massive surge over the last few months as well. I think also if you can convince people to keep that distance, that there is something invisible in the air that's produced when you're breathing and just talking to people. That awareness will help to maintain that social distancing of 2 meters or even more, even 3 meters, as it was being discussed earlier. I think the concept of this is very alien to people. They don't really understand how airborne viruses are distributed, and they don't realize that a mask being worn properly is much better than a mask hanging over one ear or under one's chin. And I think that invisible miasma is really lost on a lot of people. That's why most of my interviews are about this, actually trying to explain it.
Yeah, and I think that the whole idea of social distancing is one that is still quite difficult for a lot of people to follow. Sian, very quickly, do you think we're learning lessons? Do you think if a pandemic happens again that we will be, as a nation, as a world, better equipped to deal with it?
I'm sure we're learning. Many people learnt last time round, and I'm sure that from the horrific situation we found ourselves in here in the UK, that we will learn that we need to act quickly. But if we're going to do that, we need a strong public health system, and we need the government to invest in local public health. As Gabriel was saying right at the beginning, we need strong local public health, which is able to do the contact tracing, is able to understand communities, is able to translate the messages to communities, and that's something that's going to need investment.
Gabriel Scally, Sian Griffiths, Julian Tang, thank you very much indeed for joining me. Great to have you with us. And remember, you can see more discussion and debate on our YouTube channel. Search for TRT World Roundtable. But for now, from me and all the team here, bye-bye. Thanks for watching.